we put in the search function of our email?
Access key, Key.
Access key.
Yeah, no, this is your registration. That is not it, Amy.
Okay.
The email that was sent today, the title of the email was website login details.
Website login details. Okay.
And see,
And that is in subject, right? That is in subject.
yeah, but it said disability policy seminar in front of that. But the J Lisa, if you put that in your search, should come up because there's nobody else I know with that name. I've never seen it before.
What is the name of the person? One more time, please.
J
Jen?
Lisa, JAHLESA.
M-A-M as in mom? A?
No. J is in jar. A is in apple.
H.
As in horse. L
L.
as in Larry.
Uh-huh.
E as in elephant. S as in Sam. And A
S.
is in apple.
Okay. Thank you very much for taking time. Now I'll look under that.
Not
See
a
if I
problem.
can.
So if I have the original one, the disability policy one with the password, and I didn't get one today, should I be concerned?
I don't think so. So did you click on the link and go to the website with the password and put it in?
No.
Okay, well, I would suggest trying that. If it doesn't work for some reason, then you may want to contact them. But it should bring
I'll
you to
check it. I
this.
didn't realize that they were active.
It should bring you to this page after you've logged in. And I just kind of wanted to go over this with you from what I've looked at. Now, keep in mind, I've only been to this seminar once and it was a few years back. So I'm kind of new to this myself, but
Okay.
I went in and you get to personalize your experience. You can click on your name to create a profile. And there's some different documents in here, a participant guide that you can read through. And there's also networking, trying to connect with other attendees. So there's a lot of different things under here. But when you go to the left side, that's where you'll find those pre-recorded sessions. People have asked me about that, but this is where you find those at to view them. And then the presentations are right under that. That's where you'll go next week to watch those.
Can you scroll down so we can see the different topics for the pre-recorded sessions?
Sure. It's got the ABLE presenting in the present and future for the Achieving a Better Life experience, Medicaid and Social Security basics, regulations matter, and what to expect at the virtual disability policy seminar. So there's also a guide to show you how to use Zoom if you're not real familiar with it. You can watch that. Look at that.
You know, I am not seeing that JAHLESA, you know, any email from her or him.
And you didn't find the events at the ARC?
And I looked for events. So you're saying events at ARC? Is it, I look under that?
Yeah, events, EVENTS at thearc.org.
Okay.
That was the first email that you would have got.
I'm not sure what the purpose of the meeting today is. Is it just to get us prepped up so that we're able to go to the conference on Monday so we know what's what? Or are we also preparing for the legislative meeting?
Yes, it's the second part.
Okay.
I've had a lot of questions about getting access to the actual seminar. So I thought I'd touch on that part first and then go over what I have in the way of appointments so far and the ones that are in process, and then some of the issues. And now I emailed out to you guys the link for the 5 fact sheets that the ArcUS has put together. But there are some bills in Congress right now that are important to know about as well. And I'm going to send out the list that I have. I have 6 of them so far that'll be important for you to be familiar with, because they're likely going to be things you'll want to talk to your Congress people. Now, the way that it's set up through the disability policy seminar is that I'm making appointments with each of them. Now, so far, we're getting staff that we'll be talking to as opposed to the actual member. But I do have a couple of them that are looking for us to meet the members specifically. So as I get all those, I'll share them, and I hope to have those finished today. Other than Derek Kilmer, I cannot seem to get a hold of anybody by phone or email in his office. I'm still trying, but I have not gotten any response yet from there. And Ivanova, are you still on? Oh yeah, there you are. You said you were in the car. I know you've met with Derek Kilmer several times. Do you have a way to contact him that's different than just the main phone number or email address?
In who? Conway?
No, Kilmer, Derek Kilmer. Your
Kilmer.
congressman.
Kilburn. I'm not familiar with Kilburn.
Yeah, you are. You did a video with him
Oh,
because I watched it. Well, I'll touch base with you later on that.
Diana,
Yeah.
the
I'm sorry,
AUCD also said that they had different ways of getting in touch with people and direct emails if you are having problems. So you can try and get that
I'm
figured out.
having problems with if they've got a way to access.
Hey, Ivanova, can you mute? Ivanova, can you mute? There we go.
Derek Kilmer in the 6th congressional district. That's the one I can't get in touch with. So this meeting was basics, just to make sure people are getting into the web page so that they can register and do their things that personalize it for you. You can go through all the sessions and click a box by the ones that you want to do. And then you can share that if you've got coworkers or some other people that are also coming to the seminar. You can share your schedules and make sure, well, I'm covering this one, so you can cover that one, because there's 2 presentations at the same time in many of them. So I have been working on putting together a document that has each of the congressional people, their district, the ways that I have of contacting them, and their Facebook and Twitter, what their committee assignments are, the caucuses and groups that they belong to, as well as subcommittee assignments. And for the ones I have an appointment scheduled, I have that listed in here. And I'm going to send this out to everybody tonight. Hopefully I'll have most of it filled in. Some of them, I just have the name because he's working on trying to get a meeting with her in Congresswoman Del Benny's district. Rick Larson isn't able to meet, so he's got his staff meeting with us. Dan Newhouse and Kathy McMorris Rogers, they're still working to see if they can get an appointment with them. Derek Kilmer, like I said, I haven't gotten in touch with. Pramila Jayapal, we have a meeting with a staff person. And Representative Kim Schreier, we actually are meeting with her on the 20th at noon. And then we have staff person for Adam Smith and a staff person for Marilyn Strickland. So I will try and get information on I think it's 3 or 4 that are missing, but you'll at least know when it's set up for these others that I have so far. And I put their pictures so you know what the person looks like that you're going to meet with. Now, when we have these meetings, everyone is welcome to join each of these meetings, but it's the constituents in their district that they want to hear from. So the talking will come from whoever the constituents are for that meeting. Does that make sense to everybody? And you're welcome to put maybe in chat, if you have a question and you're not a constituent, you can put it in chat and we can email those questions to them afterwards. But during the meeting, the only people that should be talking with them are the constituents. Okay, so part of what I wanted to go into is, aside from the 5 fact sheets, there's one on community living, education, criminal justice, let's see, education. Oh, now I'm drawing a blank. There's 5 base. Oh, the ABLE Act was one. So review those fact sheets because that's what the disability policy seminar is going to be focusing on. But I also went and looked up some of the bills that are in Congress right now. And so you may want to as well talk about that. In particular, there is one that has not got a bill number yet. Let me find that one. Okay, there we go. Okay, so the Home and Community-Based Services Act of 2021. This is a bill that has not yet got a bill number, but it is something that the person that sponsored it is looking for feedback on. So it does not yet have a bill number. It's going to be in the House. And it's a Representative Dingell who is the sponsor for the bill. But this, I will give you the link. I will send this out later today so that you can read through this and go to the website where you'll find more information about this. Disability Scoop did an article on it and some others. So this would be a really good bill to talk about because community-based services is one of the 5 topics that the disability policy seminar is focused on. And that's what this bill will work on, is helping to eliminate the institutional bias of services and try and get our supports all funded in community-based services. Is there any questions on that one?
Diana, this is Aruna.
Yes.
You'll be sending the link on this one because I think you, as you say, this is really important. Would like to know more about it. But earlier you mentioned there were 5 or 6 bills and we should, in area of criminal justice, education, community living, ABLE Act, and we should review the fact sheets. Where would we find the fact sheets?
Those are on the way. Here, let me pull that up again.
And which website we can find them?
This is where you are signing up for the seminar where you were on. I was on that page there a few minutes ago. Let me find it back again.
Oh, so we need to sign up for those things. Okay.
No. You don't sign up for those. They're fact sheets.
Oh.
And now I've lost it. So let me try and find it again.
Oh, I'm sorry.
That's okay.
I just put it into the chat, the link.
Oh, good. Thank you.
Diana,
Yes.
this is Michael. Can I suggest one thing? I'm going to give everybody I'm not the greatest reader in the world, but I would like to get everybody that's going to be there my text number so they can text me if any information that, because I can read my text through as well. If we're on Zoom, however, it's easier for me to, I can text stuff as well. So I'm going to give you my phone number. This is for the group. So you could get a hold of me if you want at 206-618-4156.
So can you email that to me, Michael? And that's a good idea. If any of the other people who are attending want to be able to get in touch with others, everybody email me your cell phone, because I have a list of all the attendees. And I will send that out so that you have a list of all the other people from Washington that are attending. And if you want your phone number in there, you can get that.
So I'll do that in just a minute.
Okay, that sounds good. Thanks, Michael. So you have the fact sheets. Now, Aruna, those 5 fact sheets are just that. They're prepared by the Disability Policy Seminar, and they're like a 1 or 2 pager about a specific topic like community living, education, criminal justice, the ABLE Act, things like that. So that's what those 5 fact sheets are. But then also in addition to that, what I was talking about is bills that I've looked up for this congressional session that they're working on.
And you mentioned about the HCBS Act of 2021, which
Correct.
doesn't have the number, but the
No,
sponsor of the bill, Representative Dino, wants the feedback from community, individuals involved with disability.
correct.
So, yeah, thank you very much for bringing that. Yeah, and you'll be sending that information to us, right?
Yes. This is
Thank
the
you.
list I'm working on right now. The first one is that HCBS Access Act of 2021. That doesn't have a bill number, but I will put a link to the document so you can look at it.
Okay.
The second one is the Marriage Access for People with Special Abilities Act, or it's called MAPSA. And they introduced that a couple of years ago, but it hasn't passed. And it got introduced again this year. It's HR 761, and it's Representative Katko from New York who sponsored that one.
And what does MAPSA stand for?
The Marriage Access for People with Special Abilities Act. And it has to do with the Social Security benefits that if you're a person with a developmental disability and you're getting Social Security, if you get married, you lose a bunch of benefits just because you got married. And that doesn't happen to other people, but it happens to people with disabilities.
Okay. Thank you
So
very
that's what
much.
that bill covers.
Thank you
there's-
very much.
You're welcome. There's another bill called the Mental Health Justice Act of 2021. It has both a House and a Senate bill. Put in 1368 here. Okay, so this authorizes the Secretary of Health and Human Services to award grants to states to hire, employ, train, and dispatch mental health professionals instead of law enforcement, where there's emergencies involving either a person with a mental illness or a person with an intellectual or developmental disability. So these bills are new, so I don't, they don't even have summaries yet on the website. And I don't know what the ARC-US is going to have as far as a position on these bills yet, but we'll need to be watching them. So if there's something that's important to you, this would fall under the criminal justice fact sheet that the ARC-US put out. So if you're interested in criminal justice issues for people with IDD, this would be a bill you might want to take a look at.
So it is 1368, right? Then.
Correct.
Okay. And so they are saying they will be training the social workers or psychologists in place of law enforcement when they are interacting with person with IDD or MH needs, mental health needs.
Yes, because a lot of time the police don't necessarily need to be called and go out there.
Right,
So
right,
the
yeah.
right person could go instead to address situations and de-escalate things. It would work a lot more efficiently for everybody involved instead of just sending police out there because they don't have the expertise to deal with mental health issues or even developmental disabilities in a lot of cases.
Right, right. No, this makes total sense. Yeah. Okay.
Okay, and then we have, now I'm switching between web pages on this. Do you guys see each page as I go to it? Or do I need to
No,
reshare?
we are just seeing the list of the bills that you have put.
Okay, so 1, 2, 3, 4. Okay, so let me stop that share. Okay, forgive me, I've got a lot of stuff open and it's not letting me see everything here.
Hey, Diane.
Yeah,
What about the federal sub-minimum wage bill?
yeah,
I've actually been talking to some of Congress.
yeah, it's on my list. I haven't got to that one yet.
Yeah, I was gonna say that's one that they're interested because they've told me they're like, hey, we've been hearing from all around the country, and we of Congress want to just, we don't want to hear it anymore, so we want to shut it down.
Okay, well, let me get to that one. This, now do you see
Amen.
HR 1234 up here, Ending Corporal Punishment in Schools Act? Is that one showing?
Yes.
Okay, good. So this is a bill that has started up again this year, 1234, and it's Representative Hastings who sponsored it. And there's a number of co-sponsors on it as well. But they want to end the use of corporal punishment. And it talks about behavioral interventions for children need to promote the right of all children to be treated with dignity and have the right to be free from corporal punishment. That still goes on, especially with children with challenging behaviors. And so that is what this bill is addressing. Now, keep in mind, congressional bills can be quite long, so I haven't read through all these and don't know all the nuances of them. But just by looking up, titles and phrases, these are the ones I found that if you're interested in education issues, this may be a bill that you want to take a look at. 1, 2, 3, 4.
Does corporal just mean, physically hitting someone, or does it mean restraints and other physical ways to control children?
I believe it's talking about the restraints because those are physical things that they do to kids.
Okay.
Does
the bill talk about alternatives to the constraints and how
there was something in here, yeah. According to the Department of Education's Technical Assistance Center on school-wide positive behavior interventions and support, the outcomes with positive behavior support are decreased discipline referrals, increased instructional time. There's a variety of things that says, here's what they benefit from is positive behavior support, not these corporal punishments and negative reinforcements. So like I said, it's, you need to read through the bill, if this is a bill that's of particular interest to you in education.
But they're saying no funds available, so it's an unfunded mandate then? That's
Well,
what they,
That would depend on whether they pass it or not. If they pass the bill, it's kind of like in our state. All of the bills that come forward as bills don't necessarily have money attached to them. Or if they do need money, we don't see the fiscal note for a while later. These bills, most of them have just been introduced this year. So they haven't had time to do fiscal notes on them, things like that. There's a congressional office that does that, like we have OFM here in our state. So yeah, it could be an unfunded mandate, but if the bill gets a lot of support and passes through House and Senate, then they may decide to fund that in the budget when they get to that point. But remember, these are all in preliminary stages right now. So it's more about getting the conversation going about why these things are important to pay attention to. Okay, so we're going to go on now to 2373, which is the one that Anthony was talking about. So let me stop sharing and go back and share again. Okay, so 2373, to assist employers providing employment under special certificates under Section 14C of the Fair Labor Standards Act of 1938 in transforming their business and program models to models that support individuals with disabilities through competitive and integrated employment, and to phase out the use of such certificates. So this is the one Anthony was talking about, the sub-minimum wage. That bill just got signed by the governor here in our state. So we have a state law now going into effect that will phase out these 14C certificates so that they can't pay people, $2 an hour to do work that everybody else is getting paid minimum wage for. So if employment is a big issue to you, and especially because we have just passed that bill here in our state, then that is maybe one that you want to talk to your congressional representative about as well. Any questions on that one? Okay, and the last one I'm going to show you is House Bill 1235. Okay, so this was actually sponsored by one of our Washington representatives, Jamie Herrera Butler. And this is called the Charlotte Woodward Organ Transplant Discrimination Prevention Act. And a couple of years ago in our state, we passed a bill that a person with a developmental disability, you couldn't discriminate against them because of their disability about putting them on an organ transplant list. There was some thinking, backwards thinking about, well, they can't live as long, so they shouldn't get a priority on a waiting list. But in our state, we have already passed a bill to stop that from happening. And this is a federal bill that will follow us up on that. So if that kind of thing is important to you, House Bill or HR, House Resolution 1235 is a bill they have going in Congress to address that right now. Is there any questions on that one? Okay, so right now, these are the 6 bills that I have found so far. If I find others as I'm working this weekend, I will send those out to you, but I will send this list with links to the bill for each one so that you can just click on the bill number and it will take you to the web page for it.
Diana, this is
Yeah.
Aruna. Question I had was like the sub-minimum wage bill or the Organ Transplant Discrimination Act bill, those that have already passed in our state. What would be an effective way of communicating with our congressional delegate, whoever the congressperson is, to kind of reinforce them so that we would have a national bill similar to that? Do you have any suggestions on effective way to communicate?
Well, what I can do is on those two particular bills where we passed one in our state, in addition to the link for the federal bill that is being considered, I will put the links to our state bill that passed. And that way, when you talk to them, you can say, I can send you the link for the bill we passed here in our state, and encourage them to pass this federal one that we've set an example for.
Yeah. I just wanted to make sure, because they might say, oh, we already have it, so why are you talking about it? So
No.
I just thought, okay, thank you very much for sharing, plan on sharing that link. Thank you.
Yes, not a problem.
Hey, Diane.
Yes.
I just sent you something on an email. It's actually something that I've used in DC before. It's called Congress. It's an app where you can put in like bill numbers and it helps find all the info you need.
On your phone or your iPad.
I want to share that with everybody.
Yeah, I will send that out with those as well.
Okay. Because it's very handy for me, and I found Congress, reps, bills, anything I need, committees when it came to the feds.
Well, and that's what I use this congress.gov for. It does the same thing if you're on a computer, which I sit at my computer here all the time, as opposed to being on my phone. If we were in person in DC, we'd have to have that app for our phones, but I will send links out for both of them. That one, Anthony, and that's an Apple app, correct?
It's Apple or Android.
Okay, yeah, because I know I have one on my phone too. I don't use it very often because I'm more on my computer, but we'll send.
What's the name of the?
It's called Congress.
Okay.
And it's like it has a picture of the nation's Capitol building, and it gives you like all the committees, the reps, the senators, everybody.
Well, and it's related to this page that I'm showing you at congress.gov, because over here on the right, you can see you can click on legislation, you can click on committees, you can click on the members, you can do searches for different things. That's how I found these bills, was I put in developmental disabilities in the search line, and these were the first ones I came up with. Now, this, you need to watch those, because like it says here, there's 2 of 2,453 results. It's not showing you just the bills for this year. It shows you last year and the year before and the year before. So you want to make sure you're checking that the bill that you're looking at is current for this. We're in the 117th congressional session. So if you look for a bill, it should say 117th by it.
Anthony, could you help me with putting the link in my phone and my computer?
Yeah.
Okay, cool. I appreciate it, bud. I'll talk to you after this is over then.
Yep.
And that's also what this is for, is if you guys have questions or need help from other people who are going to be attending, I'll connect you guys all when I make the list of the people who are attending. And if there's, I think most of the people that are on the call today already gave me their address and their congressional district, but I still have 9 people that I don't have a congressional district for. And so I can't tell their congressional people, oh yeah, I have 6 people for your district that are constituents, because I got a bunch of them I don't know. So
Diana?
Yes.
This is Darcy, and I have a question specific, like kind of that pertains to that. Aruna and I both live in the 5th district. Would it help to reach out, like, because we are in the district, to Kathy McMorris Rogers, or
Yes, because I don't have a meeting set with her. So if you can-
Her disability policy staff spoke to our Advanced Leadership Academy a couple months ago, and so maybe if both of us send like an email and say that
other stuff
that
for the legislative stuff.
our group is going to be there.
Can you mute? Here, let me, there. Okay, sorry, go ahead, Darcy.
I was just going to say that maybe if Aruna and I don't know if anybody else is in the 5th district, maybe reach out to that staff person specifically that we met like a couple months ago at our Advanced Leadership Academy and ask for an appointment, or would that be helpful? Or
yeah, I have 3 people for the 5th district, you and Aruna and Etane Chan. I don't know if you know who she is or he. I'm not sure.
No. Okay.
And then I have Julia Bell. She hasn't responded. I don't know which district. I know she's out in Big Harbor, but I don't know the district. Tammy Dillon, Phil Tracy, and then there were 3 this morning, Karina Fail, Felisa Castellanos, and Lee Spruce, that I don't have district numbers for them because a lot of people signed up using their organization's mailing address or PO box. And that doesn't
Tammy Dillon is with Skillskin and she's in Spokane.
So is that 5 then?
5, yeah, I'm sorry.
Okay, good. Well, some cities, they are split sometimes. So I want to make sure that I've got the right ones. Okay, well, I'll put her down for 5 then. The 3 at the Arcus and the Snohomish County, I'm gonna try calling them, see if they can tell me who those 3, what district they live in. And then Phil Tracy, I'm not sure if that's Donna Tracy's husband. I don't know for sure. He's on the DD Council. Anthony, do you know?
Yes, that is Donna Tracy's husband.
Okay.
Yes, it is. So probably the district is the same as mine and Anthony's.
Yeah, 4th.
Okay, good. That helps too.
Because I think they both live in Pasco and Franklin County. So, yeah.
Okay. Well, it's narrowing me down. I got 5 left. I don't know. Hopefully, by the time we start meeting with people, we'll have everybody plugged into a district.
And thank you so much for doing this.
Yes.
You're welcome.
Thank you. Thank you.
It's another step for me. I do a lot of the policy stuff in the state, and now a little bit more involved in the federal one. And traveling to DC is not easy for me to do, so I've only gone the one time.
Is anyone else from the 6th district?
Yes, we have a few people in the 6th. I live in the 6th district. I have Bart Poole, Ivanova Smith, who was talking earlier, Ramona Hattendorf. Oh no, she's 7, sorry. 1, 2, 3. Molly Brooks.
It starts at
me.
Okay. And then Barb Poole. And Jeremy Norton Paul. He's the DDC director.
Okay, girl.
So those are all the 6th district people. 7 is who we have the most people for in Jayapal's district. There's 8 people in that district.
I'm gonna drop my email in the chat box. If anyone else in the 6th district wants to, because I don't actually know anyone in person.
Like, make sure there's no emails from Shaw or.
Yeah, good. Yeah, that's it. And then you can split. You're like, really good with that.
Hi, everybody. Sorry to I'm going to jump in here. This is Susan Sturms with the UW. I'm a UW Blend trainee. And I just wanted to hop in while we're talking about the 5th district. And Diana, when I watched the pre-recorded session on ABLE, they mentioned that this year there is an ABLE Age Adjustment Act. And so the numbers on that, there's a House bill and a Senate companion bill. The House bill is 1219, and the Senate bill is 331. I'll put that in the chat. And if you watch the pre-recorded session on April, you'll find that. And the reason I wanted to mention that in this conversation is that Kathy McMorris Rogers is one of the prime sponsors of that piece of legislation to extend the able age adjustment from the age of eligibility being limited at 26 to 46. So I just wanted to let you guys know that it's something, if you meet Kathy McMorris Rogers, it's something we can thank her for.
Yes.
Thank you, Susan, for that information.
I will make sure I add that to the list of legislation that I've started.
Where do you go for hearing, listen to the hearing Susan was talking about? She listened to hearing or something?
Sue, do you want to talk about that?
Oh, yeah, sorry, I was chatting and I'm on my phone, so I'm going back and forth. It's actually one of the pre-recorded webinars for DPS. So if you go to that DPS website that Diana was showing us in the beginning, and it has that list of 4 pre-recorded sessions. One's on Medicaid and Social Security, one's on the ABLE Act, one is on why regulations matter, and then one is just kind of an orientation and what to know about going to DPS. So it's actually one of our pre-recorded webinars for DPS, and you can access it from the website. Is this information on the ABLE in general, and then the Age Adjustment Act that's been introduced this year in particular. So something that could be an advocacy talking point, and something that I'm pleased to see one of our representatives in Washington State is a prime sponsor of. I didn't know before this that Kathy McMorris Rogers has a child with Down syndrome. So that
right,
I learned
she
something.
does. Yeah, she does. Yeah. Yeah, I think her representative and her legislative assistant who had come to give presentation to our Leadership Academy had mentioned this also. Yeah, thank you very much though for giving the bill numbers because this is really helpful for the TBI population when people have brain injury, at later stage in life, this ABLE Act would be able to help greater population.
Right. So I will add that. So we have 2 legislators who've sponsored legislation we're watching then. Representative Herrera Butler, and then with Kathy McMorris Rogers. So this I shared back at my screen for the disability policy seminar, and over here on the left side is where you find those pre-recorded sessions that you can watch.
I wanted to raise a slightly different issue. I've been looking a lot at housing for people with IDD, and of course part of the issue is just a lack of affordable housing. But Jamie Herrera Butler and some other folks have just introduced something they're calling the Housing Supply and Affordability Act. So it's not specific to IDD, but would it be okay to raise something like that in our conversation?
Yes.
Okay.
Housing covers a lot of people, but it includes our people.
Yeah, I'll put in a link in the
that would be great.
in the chat to an article about it.
Are there other questions?
I have one more, Diana.
Sure.
Because I don't know what this person looks like. Could you send me a picture of my representative, please?
Yes.
She's brand new.
Here, let me show you what.
She's in the 10th. I don't even know what she looks like. I'm gonna be that honest about it.
Okay, so I'm going to share this page. This is one I'm going to send out to you. So this has all of the congressional people here, and it's got their picture on the left-hand side.
Sweet, okay.
So you'll get this. I'm trying to fill in all the appointment things. I don't have all of them in yet. But I
Peachy, I definitely would love that.
That way you'll have their pictures, yeah.
Thank you, instead of just their name. I appreciate it.
Yep, not a problem.
Thank you, thank you, thank you, thank you.
So are there other questions?
Yes. I'd like to find out whether it's appropriate to bring up other issues to the Congress people, things that are not up for legislation, like new ideas. Is that appropriate or is that not appropriate?
Yes, because we're still at the beginning of the congressional session. So if they find an idea that they think should be made into a bill, they have time to do that. So, as long as it's pertaining to developmental disabilities and would benefit their services, yes, I would say go ahead.
Okay. Would you
And
like
it's the
to
first
hear
of the
it
2
now?
years, not the second.
Can
They
I
don't vote, they don't run again for another 2 years.
Can I tell you what it is now?
Sure.
Okay, so I have a mental health disability, and it's not quite categorized as a developmental disability, but I am somewhat on the spectrum. And I've had a real hard time getting full-time work and getting off disability. And one of the main reasons is that the rules for disability don't allow me to try working full-time because I already used the trial work period. And I'm a special education assistant at the school district. And there's all these long-term sub possibilities that I could take to try to work full-time. But if I lose it, I've gotten disability for so many years. If I lose the job, then I won't be able to go back on disability. I'll have to apply all over again. And so I'm real interested in having there be a change in the rules of how much you can work and still get your benefits.
So are you talking about your health benefits, like through Medicaid?
Yeah, well, I'm on SSDI, so it's Medicare and Medicaid. But the main thing is that I would lose the check that I get every month, and I might lose my insurance if I took a long-term sub job, which would be really good for career building. But if it didn't work out, because lots of times the school district says, well, we might have a position. And so it would be much easier if I could work. And then if it didn't work out for some reason or another, I'd be able to get back on my benefits easily.
HWD is a program.
Well,
No,
but that covers the healthcare benefits, and I think she's talking about the financial.
I'm already on HWD. But the issue is that once you use your trial work period and your extended period of eligibility, the moment that you make more than SGA minus earlies, you're off of disability. And there's a pilot project, I don't know where it is. It's somewhere in the country where they're allowing you to work. And if you make more than SGA, then your SSDI payment gets decreased, but you don't get kicked off of disability. And for me, the rules have interfered with me being able to get my feet wet and do enough work so that I can show that I'm capable of working full-time for the district. So I'm real concerned about the rules for SSDI impeding people from working full-time.
So Amy, have you worked with a benefits planner?
Yeah, I've done all that.
Okay.
It's once you're done with your trial work period and extended period of eligibility, the moment you make too much money, you get off disability unless you are getting off disability and you lose your job because of your disability. If you lose your job because of your disability, then you can stay on disability. But if you lose your job just because you lose the job and the school district said, oh, well, I'm sorry, we thought this was going to last our year and it's only going to last 2 months, you're stuck.
Diana, could I respond to
Sure.
Amy? Amy, you tell your story really well, and I've been to many of these disability policy seminars, and the most effective thing is somebody telling their story. And, you know, you can leave it up to them to research it and, you know, apply it to whatever bills it might affect. I have found that the legislative aides are really good at sorting out what you said. And when you say, this is my life and this is how it would affect me if this happens, and you know, you're clearly intelligent and you've already tried everything you can try. And I think if you just tell your story, it'll be very compelling, even if you have to tell it to each one we meet with. I mean, I would highly encourage you to do that.
Well, I think I could only tell it to my congressional division.
That was one of the things we talked about earlier, was that we're setting up all these meetings with all 10 of the representatives, and all of the group can join those meetings and listen in, but the only ones who should be talking during the meetings are the actual constituents. And there are 8 constituents in that district. So we want to make sure everybody has a chance to talk as well. So Amy, one of the things I might suggest is that you talk briefly about what your issue is and then say, can I follow up with you with an email about this? And then you can give some more detailed information, but the LA will have heard from you personally, this is my story and what's happening to me, and I need some help. Does that work?
And one thing that I've thought about while we were talking is that I could write up the issue and I could send it out to the people that are going to the policy seminar. So if they wanted to bring it up with their Congress people, they would have the information. So maybe I can send that to you, Diana.
Yep, that works.
And then the other related issue is that because I have appointments during the week that I have to go to, that really working 5 days a week is too much. And it would be great if there was some kind of act that allowed employers to get some kind of a tax break or something if they employed people with disabilities 4 days a week rather than 5 days a week. Because it's really hard to get your appointments in and to work 5 days a week if you have a disability. But I work 4 days a week in an AmeriCorps job, and that worked out. And I was the first one in Washington State to get an accommodation of 4 days a week doing AmeriCorps rather than 5 because of my disability. So I'm real interested in working, but there's barriers, and so I can outline the barriers.
Okay.
Thank you for the
I
time.
noticed there's a lot of stuff in the chat, and I haven't been able to watch that and the other things that I'm doing, but I will save the chat and go back through that. And if there's questions that didn't get called out and asked, then I'll try to respond to those.
So Diana, when we meet with our senators especially, there's a lot of us. Will we have like a little agenda and who's going to address what, or how does that work?
There are a lot of us. If everybody shows up, we've got like 39 people. Well, no, we added 3 more, so 42.
Wow.
So yeah, it would be good if maybe when I send out this stuff, I will break up the 5 topics that, you know, the seminar has given us to focus on, and then everybody can let me know, you know, which topics are important to them so that we have a group of people who say, talk about, employment stuff, or a group of people, so that we're not trying to do it one by one. And maybe these 5 people will throw in something. And you can, like I said, we can always follow up these meetings with an email. Now for Senator Murray and Cantwell, we have an hour with their LA. So at least we have extra time there.
Okay.
The representatives are going to be shorter. It'll be 15 minutes to a half hour likely. So will that work? Does everybody feel comfortable with that? Kind of doing it in a group at least for the 2 senators?
Would the employment fall under the SSI, SSDI rule?
Right. Well, that would be under Social Security probably,
Okay.
because that's their rules.
And Diana, you probably explained this already, but will you send us a list of who's in our district so that we kind of know when we're meeting with that representative, which ones of us will have the opportunity to speak?
Yeah, like I said, I'm still trying to nail down districts for some people, but I'm going to get it as good as I can by the end of today and then send it out to everybody.
Diana, if we still have questions about the website and stuff, who do we contact? Because I'm still trying to figure it out.
You mean your access code, or just trying to figure out the website?
Just trying to figure out the website. I have my access code.
Okay, and so what are your questions about it?
I don't know. I'm still confused about exactly. Like, are there? I don't even know how to word this. Are there like different things we can go to during each time period, and if so, how do we find a list of that?
Okay, I'm going to share the screen for the disability policy seminar here. Okay, so these are the scheduled events, and those are the pre-recorded ones right here we have. Then it gets down to what the general sessions are. And over here on the right-hand side, you can click that star to say, that's the one I want to go to. That's my favorite. I want to go hear about housing. So I have that starred. And you'll see that both Housing Where We Live and Supporting the Direct Care Workforce are both at the same time. So you have to choose one or the other of those. But
did they record the other ones? Like,
I have not found the answer to that yet. I've been trying to figure that out. Are we going to be able to go back and watch these later?
Yeah, that's what I'm hoping.
Yeah, I see the pre-recorded sessions, but I don't know about the other ones. I haven't seen anything that has asked that, but I will be trying to find out. So you just go through. There's a networking social hour. There's one for parents, self-advocates, siblings, and then other allies and advocates. So you can choose one of those. And there's a general, it usually starts with a general session that everybody does, and then gives you different sessions where you're gonna, this one, that community can't wait, that Access HCBS Act, that they're looking for feedback on. They'll be talking about that. Improving Social Security and supplemental security income. So just kind of browse through these and figure out which ones that you want to be at, and you can star those, and then you can share it with other people from your group so they can see, you're going to this one, okay, I'll go to that one. Does that help any?
Yes, it helps a lot. One more question. Is everything Eastern Standard Time?
You get to choose that. Back in when you did the profile, I already set mine up, but I think it was, nope, that's not it. I'm trying to remember. It was one of these over here on the side. It might be the participant, that was a PDF file. The fact sheets are on here. You can find them here, but you can also find them on the main disability policy sign up registration page without going in.
Yeah, so if it says PD, which Diana's does, that means Pacific Daylight Time, our West Coast time.
Correct. I chose that when I first set up when I first went into the website, it wants you to set up a profile. And you can put in what you want to or what you don't want to. But part of that profile included which time zone do you want to see this in? Because I remember.
So if we're in our time zone, does that mean that things will start at 9 or are things still going to start at?
It will start at 9.
I've been freaking out about getting up at 6 in the morning.
No. No, if it's 9 o'clock our time.
Oh, okay.
And all of these meetings with congressional people, while I'm talking with them back and forth, I'm making sure I put in, it's this Pacific time, this Eastern time, so that they see, okay, I'm talking about 9 o'clock my time, even though it's 12 o'clock your time.
Okay, thank you.
Diana?
Yes.
This is Aruna. You mentioned about having signed up, like I found that email at events@thearc.org. When I go to URL, okay, so what do we need to do? We need to register for each of the seminars that we are going to attend?
No, you don't have to register for them.
Each one of them. Oh, okay.
Yeah.
Do we have to put the personal profile you were saying a minute ago?
You don't have to, but it does make it easier for you. Like we were just talking about with the time zone, you can set it to give you everything in our time zone. So you're not looking at things in Eastern time and trying to figure out 3 hours back so that you can make sure you don't miss it. So
okay.
Doing the profile, you don't have to fill, it's a lot of different things. You don't have to fill it all out. You pick and choose which things are important to you in your profile. To me, knowing it was in my time zone was important.
Okay. Okay, because use the website to, let's see, a website to review the full schedule and mark your favorite for easy access. So the disability, okay, I'm just getting, I went to the site, but boy, do we have to give the consent for everything? Privacy notice and all that stuff?
Well, I believe you do, yeah.
Okay. Okay. All right. I'll do that. And okay, thank you.
And you can always email me later, Aruna, if you find something else that have a question.
Yeah, I just want to make sure I can get in.
Right.
I'm still having a problem change. It says everything's in Eastern Standard Time and I can't. Has anyone else changed that? Does anyone know how to?
Well, I did, but I don't remember when I did it, where it was at, because I can't find my way back there. I already did my profile and I can't find where it's letting me get back into there.
I did my profile, but it didn't ask me that.
Sorry.
Okay, you can select your language there.
Hi, Diana and everybody. This is Gabriela Young from Vancouver, Washington, with Hispanic Disability Support of South Washington. I just gotta say thank you for all the information, and I look forward to the emails with the bill information and other information that we need for those meetings. And thank you. I have to go to an appointment, but I'll see you soon.
Okay. Yeah, watch things. I'll try and send things over the weekend before Monday morning.
Sounds great. Thank you for all the work. You guys are doing awesome.
You're welcome. So I recorded this session, so I'll post it on the web page that I sent out to everybody. So that if anybody misses it, they can go back and maybe see some of the other questions. And I'm going to find that place where I did my profile, and then I'll make sure I send that out to everybody as well. So were there any other questions? Are you guys ready to go on Monday?
I still just cannot
Better
find
believe it.
time zone.
I will work on it, Molly, and find it and send it to you.
Thank you so much.
This is my first time with the disability policy seminar. I just found it. I don't know how I found it. Is it just for developmental disabilities, basically?
Well, it's focused on intellectual and developmental disabilities. Yeah, the
Okay.
organizations that put it together, that's their focus.
Yeah, because mental health is the #1 reason people become disabled. And I was wondering if there was any interaction like between the ARC and NAMI.
Yeah, we've worked with NAMI on different issues because there's a lot of issues that are considered cross disability. You know, may have mental health as a condition as well as the developmental disability, or they may have a physical disability. You know, it can cross over lots of different areas. Just like I was talking about earlier with housing. Housing is an issue for everybody. But people with developmental disabilities have a larger problem because they need accessible housing as well. Same for people with physical disabilities. But it all crosses over into the same pool of we don't have enough housing. So is everybody good to go?
Is there any kind of conference that deals with all the
Not that I'm
kinds of
aware of. I mean,
disabilities?
there may be, but I don't know of it. I mean, that's like I do a lot of work in the legislature, but I stay focused on intellectual and developmental disabilities. If I tried to focus on all disabilities, I would be trying to scramble way more than I am now. But that's why we have groups like NAMI, you know, and I know with the Developmental Disabilities Council that they have some focus on TBI, traumatic brain injury. There's the Governor's Committee on Employment and Disabilities. That focuses on more, you know, Disability Rights Washington. They focus on developmental disabilities as well as mental health issues. So there's lots of groups out there that focus on different pieces of the community.
Because we have like 2 councils in DRW. One is the developmental disability. It's like a disability council, and the other one is a mental health council.
Right.
Kind of utilizes all that in one for our state board for DRW.
So are you with DRW then?
I'm one of their board members.
Okay. So they have a mental health council with board members and so on?
Yep. They got a disability council, they got a mental health council, and then they got their lower agency, the DD ombuds, and then they got the DRW on top with the state board and everything.
Well, and then they have Passport for Changes underneath of them as well.
Yeah.
What does that refer to?
That has to do with providing care, attendant care,
okay.
Personal care. I forget what the acronym stands for.
So Diana, I reviewed the disability policy seminar fact sheets. and legislative priorities. And then I went to the NAMI website or the WAMI website, and I kind of wrote a compare and contrast a little bit. And I'd like to send it to you if that's okay.
Sure, that's fine.
Well, thank you very much.
Okay, well, I'm going to let everybody get out to the sunshine, enjoy a few rays before they're gone. That we recorded this, so if people have questions, they can watch this. If you still have questions, email them to me. If I don't know the answer, I'll send them on to the ArcUS and ask them. Is that good? Okay, everybody, have a good weekend, and I'll see you all on Monday morning.